From here, I would like to talk about hygiene and infection in acupuncture treatment. Infection can be defined as the process by which pathogenic microorganisms establish themselves and proliferate within or on the tissues, bodily fluids, or surfaces of humans, animals, or plants. For an infection to occur, three key elements must all be present: a source of infection, a route of transmission, and a susceptible host. In acupuncture practice, the host can be either the patient or the practitioner. Preventing infection means breaking at least one of these three elements. For reference, it is said that a single drop of water can contain more than 10,000 viruses and up to 1 million bacteria, so even a very small amount of contaminated material can carry enough pathogens to cause infection. So what happens when the human body becomes infected? First, pathogens penetrate the body due to a breach in the physical defense barriers. Next, the internal immune system distinguishes between self and non-self. Finally, defense mechanisms are activated through both humoral and cellular immunity. These are the three basic stages of the immune response. In acupuncture treatment, infections can be broadly divided into two types. The first is endogenous infection, which is triggered by a source within the patient. For example, microorganisms from the gastrointestinal tract can invade the peritoneal cavity if the mesentery or intestines are injured, leading to peritonitis. The second is cross-infection, which occurs when pathogens come from another person or the external environment, such as through contaminated needles, needling through clothing, or reusing instruments. General guidelines for preventing infections state that the medical practitioner protects themselves and reduces the risk of transmitting sources of infection to patients through proper personal hygiene. In practical terms, this means that we should maintain the cleanliness of the skin, scalp, and hair, wash our hands frequently, and keep our fingernails short and clean. Maintain good oral hygiene to prevent bacterial transmission, and keep our gowns, footwear, and other attire clean. By following these basic principles consistently, we can greatly reduce the risk of infection in acupuncture practice. To perform acupuncture treatment at the level of clean needle technique, we need to understand the concept of asepsis. Asepsis refers to the absence of pathogenic microorganisms, and its purpose is to reduce the risk of infection in the healthcare environment. To maintain asepsis, we should reduce microbial flora on the skin through proper hand washing or hand sanitizing. We should also use only officially certified skin antiseptics and sanitizers according to the instructions, and handle sterile supplies carefully so they do not come into contact with non-sterile surfaces. In addition, we should wear appropriate personal protective equipment to prevent the transmission of microorganisms from the patient to others. For all invasive procedures, including acupuncture needling, we must use only sterile single-use items such as needles or lancets. If there is any suspicion of contamination, the medical supplies must be discarded immediately. For disinfection, there are 5 main points we need to keep in mind. First, we should review and establish a clear plan for the scope, duration, and method of the disinfection process. Second, alternating between different types of disinfectants can help prevent microbial resistance. Third, we need to consider the concentration, amount, and contact time of the chemical agents in order to maximize the effect of disinfection. Fourth, before applying disinfectants, we should remove dust and thoroughly clean the target surface or object. Finally, we need to remember that disinfectants do not always work immediately, so continuous and repeated application may be necessary. It is also important to distinguish between disinfection and antisepsis. Antisepsis refers to the use of a chemical agent specifically designed to reduce the number of microorganisms living on human tissues, especially the skin of patients or healthcare practitioners. In other words, disinfection is a broader procedure used to remove infectious sources from the surrounding environment, while antisepsis focuses on reducing contamination on the patient or practitioner. To prevent infection during acupuncture treatment, we need to remove pathogenic microorganisms from the skin surface or mucosa through proper skin antisepsis and disinfection. The most commonly used antiseptic is 70 to 80% ethyl alcohol. Depending on the patient's condition and the level of contamination, povidone iodine, commonly known by the brand name betadine, and chlorhexidine may also be used. It is worth noting that 90% isopropyl alcohol evaporates too quickly, so its antiseptic effect on the skin is relatively weak. When using povidone iodine, we should wait about 30 to 60 seconds until the liquid has completely dried on the skin, because its antimicrobial effect increases during that drying time. Chlorhexidine is used for disinfecting the skin and mucosa, but its effect against viruses and Mycobacterium tuberculosis is relatively weak. When disinfecting the skin with an alcohol swab, we should avoid rubbing in a zigzag or inward spiral pattern. Instead, we should clean the skin in an outward circular motion, or in one consistent direction, and we should wait until the alcohol is dried completely before inserting the needle. To prevent infection during acupuncture treatment, we should pay attention to the following points. We should always wash our hands between patients. If our hands become contaminated before administering acupuncture, we should wash them immediately. We should use only sterile, single-use, disposable acupuncture needles. We should also establish and maintain a designated clean field, and used needles and other invasive instruments must be discarded separately and disposed of properly. A clean field is a dedicated clinical work area for handling sterile instruments and performing procedures. Its purpose is to maintain the sterility of acupuncture needles and tools. In acupuncture treatment, the clean field includes the surface where the instruments are placed, the area where the needles to be used are set, the skin site where the procedure is performed, and anything that comes into contact with the skin. One of the most important factors in infection prevention during acupuncture treatment is hand washing by the practitioner. When washing the hands, special attention should be paid to the fingernails, which should always be kept short and clean. We should wash our hands every time we move from one patient to another. For example, if we begin treating another patient and then return to remove needles that were previously retained in the first patient, we need to wash our hands again each time we move between them. If the hands become contaminated again after washing, then regardless of whether the contaminated fingers touch the intended needling site or not, the fingertips should be cleaned before moving on to the next step. Gloves should be worn when there is contact with blood, potential sources of infection, mucous membranes, or damaged skin. Gloves should be removed immediately after treatment and changed for each patient. Even in the same patient, gloves should be changed when moving from a contaminated body area to a clean one. As an alternative to hand washing, an alcohol-based hand sanitizer containing at least 60% alcohol may be used. Although there may be some differences among healthcare professions, the following is a generally accepted hand washing procedure. First, roll up your sleeves and remove all jewelry. Next, wet your hands and apply an adequate amount of soap. Then rub your hands together to create a rich lather. After that, scrub all surfaces, including the fingers, nails, and wrists, for at least 15 seconds. This basic procedure is simple, but it is one of the most essential steps for reducing infection risk in clinical acupuncture practice. Here are some important precautions for infection prevention during acupuncture treatment. We must always use sterile, single-use disposable needles, and they should never be disinfected and reused. The practitioner must wash their hands both before and after needling. Sterile disposable needles should be stored in sealed packaging, used within the expiration date, and discarded if the expiration date has passed. We should also use a sterile guide tube. The same guide tube may be reused for the same patient, but it must be replaced before being used on another patient. We should never insert needles through clothing. If any needles remain after treatment and are not used immediately, they should be discarded. Acupuncture must be performed according to aseptic principles, and sterile needles should touch only the disinfected treatment site. If a sterile needle touches any other surface, it should be considered contaminated. Used needles must be disposed of in a medical sharps container. In addition, sterile disposable needles should never be opened in advance and left inserted in a needle holder or sponge pad. We must also be careful about the risk of cross-infection. Although the upper handle of the needle may be touched with bare hands, the part that enters the skin must never be touched. If contact with the needle body is necessary, sterile gauze or cotton should be used. Before and after acupuncture treatment, we need to check the patient's condition carefully and prepare the treatment area properly. The patient should be placed in a comfortable position that can be maintained for a certain period of time. We must also check carefully whether there is any wound, injury, or disease at the intended needling site. Acupuncture should be used with caution on burned areas, boils, skin diseases, or injured regions, because infectious materials may spread into the body through damaged skin. Before needling, we should carefully confirm that the body area is clean, and the treatment site should be disinfected with an alcohol swab. If the site is very dirty, such as the foot, it should first be washed with soap and water, and then cleaned again with alcohol. 70% isopropyl alcohol is appropriate for skin preparation before needling. For patients with a compromised immune system, betadine may be used first, followed by alcohol disinfection. During injection therapy or acupuncture treatment, one type of infection-related accident that can occur in the clinic is an accidental needle stick injury from a used needle. This is referred to as cross-infection. According to reports from the United States, 58 to 80% of occupational HIV exposures in the healthcare sector occur because of accidental needle stick injuries. The estimated transmission risk after a needle stick injury is 6 to 30% for hepatitis B virus and 0.5% for HIV. In addition, acupuncture treatment itself can cause pain or tissue injury after needling. There is no perfect way to eliminate all unnecessary pain, but healthcare professionals should make continuous efforts and practice to minimize it. If a patient frequently and continuously complains of pain during insertion, the practitioner should reevaluate and improve their needling technique. It is also necessary to check whether defective instruments or an inappropriate needle thickness may be causing unnecessary pain. Before needling, the practitioner naturally touches the patient's skin while locating and confirming the acupoint. Even during this process, both the practitioner and the patient may be exposed to infection risk. Therefore, it is important to follow several basic procedures. If the practitioner's hands are not contaminated, it is acceptable to palpate the clean skin before inserting the needle. However, if the practitioner's hands are contaminated, they must wash their hands or clean their fingers with an alcohol swab before handling the needle or touching the needling site. After hand washing or alcohol disinfection, Nothing else should be touched except the needle package, guide tube, and the needling site. If the practitioner touches anything else, the fingers should be cleaned again with alcohol before proceeding. In some situations, wearing gloves is recommended to protect both the practitioner and the patient. Gloves are essential when there is a risk of contact with a large amount of blood, contact with secretions from an open wound, treatment of a patient with an infection, an injury on the practitioner's hand, contact with damaged skin or lesions, needling in the oral or genital area, or when bleeding is expected during routine acupuncture treatment. As I mentioned earlier, acupuncture treatment can involve several adverse events and risks. Here, I would like to summarize the main categories of adverse events that may occur during needling. The first is acupuncture fainting, which is also described as syncope, needle shock, or hunjen, and it is often caused by anxiety, fatigue, or strong stimulation. The second category is tissue and organ injury. This includes mechanical injury caused by the needle itself and internal organ damage. The third category is infection, especially the transmission of pathogens due to inadequate sterilization or poor hygiene protocols. The fourth category is hypersensitivity and allergic skin reactions triggered by the needle material or cleansing agents. The causes of acupuncture fainting include psychoneuroasthenia, pernicious anemia, cardiac disease, severe illness, excessive sweating, severe diarrhea, needle phobia, extreme fatigue, excessive stimulation, and a weak or frail constitution. At the early stage, the patient may show signs such as pallor, profuse sweating, palpitations, chest tightness, dizziness, nausea, or vomiting. If the condition progresses, the symptoms may become more serious, including sudden coldness in the hands and feet, cold sweating, a weak pulse, and hypotension. If emergency management is not provided properly, the patient may enter a severe state with loss of consciousness, pale lips or cyanosis, and even fecal or urinary incontinence. For the prevention and emergency management of acupuncture fainting, there are several immediate steps we should follow. First, all inserted needles should be withdrawn quickly and safely. Second, the patient should be placed in the supine position, with the head lowered and the feet elevated. Third, any tight clothing, collars, or belts should be loosened. Finally, we should help maintain body temperature by giving warm water and keeping the hands and feet warm. To prevent fainting during acupuncture treatment, we should also be especially careful when the patient is weak, fatigued, hungry, or emotionally sensitive. In these cases, it is better to treat the patient in a lying position, manipulate the needle gently, and watch carefully for any unexpected reactions by continuously observing the patient's facial expression and complexion. There are several types of organ and tissue injury, as well as infection, that can occur during acupuncture treatment. One important example is pneumothorax, which may present with symptoms such as chest pain, dyspnea, pallor, cyanosis, and even loss of consciousness. When needling the chest region, special caution is needed because the risk of pneumothorax increases if the patient breathes deeply or coughs during the procedure. Acupuncture can also cause vascular injury and bleeding. In general, if the bleeding is venous, we apply direct pressure for about 30 seconds to 1 minute. If the bleeding is arterial, direct pressure should be applied for at least 5 minutes. As I mentioned earlier, organ and tissue injuries caused by acupuncture can take many forms. To summarize, they include local hematoma, cardiac tamponade, peripheral nerve injury, central nervous system injury, and visceral organ injury or internal damage. For this reason, a clear understanding of the anatomical characteristics of the needling site should always be the first priority in preventing accidents. During acupuncture treatment, infection or damage can also occur in the skin and subcutaneous tissues. The main cause is that invasive procedures penetrate the skin barrier. Clinically, patients may present with blisters, bruising, hyposthesia, necrosis, fever of unknown origin, or severe pain. Common morphological forms include vesicles, crusts, folliculitis, and cellulitis, which is the most frequently reported type. In terms of treatment, antibiotics or antiviral agents may be required depending on the cause of the infection. We should also keep in mind skin hypersensitivity reactions. Localized reactions may include erythema and itching due to histamine release. Patients with dermatitis or metal allergies are at higher risk, and in such cases, one practical approach is to reduce the total number of needles used. Finally, with this, I have given you an overview of acupuncture treatment, along with the key issues of hygiene and infection control. Thank you for listening.